From the Dignity Health Studio at the Bakersfield Californian, this is Live Well, your weekly look at all things great about living in Bakersfield and Kern County. And now, here's your host, Lisa Kirsch.
Good morning, everyone, and welcome to Live Well for this Wednesday, August 13th, where every week the pages of Be Well and Bakersfield Life magazines come to life, showcasing living well here in Bakersfield and beyond. I am your host, Lisa Kirsch, and today we have an extended program for you. We're going to start with our visit from our friends and our sponsors at Beautologie. We'll catch up with them. We'll get some skin-saving advice on how to pamper our own skin during these dog days of summer, and we're going to learn about tattoo removal and a free clinic that they have coming up. Some very exciting stuff, so you won't want to miss that. Also this morning, we'll get some valuable tips on how to transition from summer fun to back to school, as school bells will be ringing all across Kern County for most. Come Monday, it's almost time to head back to school. We'll also flip through the pages of our newest issue of Be Well magazine with its editors. And sadly, today we are going to say goodbye to a member of our Live Well family. That is all ahead this morning. But first today, here's what is trending in the news locally. We start with head injuries, and more than 120 Kern County High School coaches, trainers, and athletic directors will attend the 9th annual Head Injuries in Student Athlete Symposium. It's coming up this Friday. It's presented by Hall Ambulance Service in cooperation with the Kern High School District. Hall Ambulance Medical Director Dr. Ron Ostrom will lead a discussion on the latest information in the prevention and detection of mild traumatic brain injuries in our local student athletes. The idea is to help coaches and staff properly respond to athletes with concussions and to follow proper return-to-play procedures. A concussion is caused by a bump, blow, or jolt to the head or penetrating injury that disrupts normal brain function. Sunday will be all about brides and grooms as the ultimate bridal event comes to the Doubletree by Hilton. More than 60 wedding specialists will be on hand to answer wedding questions and to offer their services. The event runs from 1:30 to 3 o'clock on Sunday at 3100 Camino del Rio Court, and I'll be there emceeing that very special event. You can learn more and check out ticket prices at ultimatebridalevent.com. Valley fever research. An estimated 200 walkers plus many dogs showed up at the Kern County Museum's Pioneer Village on Saturday for the Walk for Valley Fever. All proceeds went to the Valley Fever Americas Foundation to support research toward a vaccine, as well as a renewed focus on development of what's called Nicomycin Z, or NIC-Z for short. It's an antifungal treatment drug that has shown great promise in animal trials, but has not yet been tested in humans. The CEO of Valley Fever Solutions, David Larwood, said the company is on the edge of making large-scale commercial amounts of that drug, which it's, quote, pretty sure can stop that disease in its tracks, end quote. Today's show is sponsored by our friends at Beautologie. We have Dr. Milan Shah joining us today, and he brought along a very special friend. This is Jorge. Good morning.
Good morning,
Welcome
Lisa.
to you both, guys. Great to see you as always.
Thank you.
Now, we are talking today about tattoo removal. Now, how is this done? Is it done with a laser?
Yep. Basically, it's a laser. Specifically, the type of laser is called an NDQ switch YAG, and it's a laser light that sees that ink in the tattoo, and it causes a burn of that ink. And by doing that, it's going to break up that ink, and over time, it's going to lighten it. Tattoos are very different. They're different in terms of their colors, how deep the artist buried the ink, the age of the tattoo, and because of there's so many variable factors. It's variable in terms of how many treatments it's going to take to get rid of it.
Right.
Generally, it can be anywhere from 1 or 2 treatments up to 15 sessions, depending on that intricacy of the tattoo.
And can they be erased? Can they just be like they never happened?
Absolutely. We've taken many tattoos to they're completely gone over the course of a few treatments. Over at Beautologie at our office, we've been doing tattoo removal for a little over 5 years now. Our Probo clinic has been going for a little over 4. But yes, we have some wonderful results. There are some really deeply embedded tattoos, multicolored tattoos that sometimes may leave a little bit of a shadow. But even those, if you looked at them from far away, you wouldn't be able to tell that there was something there.
And you see some with many colors. And you mentioned that even the colors can be removed. Is there anything that's particularly harder to get rid of?
Yeah, that's a great question. Years ago, we could only do those blue and black, dark black tattoos. Right. Now we have different filters that see those different colors. And so we can go after blues, blacks, oranges, yellows, purples, and greens. the thing is, there are some colors that are a little bit more difficult than others. Yellows and oranges are probably, and some light greens are going to be more difficult than your blues and blacks and reds. The lighter the ink, the more closer it is to your skin tone,
Right.
the harder it's going to be for that laser to differentiate those two colors. And so it does get a little bit more tedious, but it's not impossible.
Interesting. Now, is this something that also depends on the color of the person's skin?
Yes. So, lasers in general have to, they go after color. And they're specifically meant to go after the ink in this case, but they can sometimes get a little distracted and go after the skin color as well.
Like a mole or something else too, a variation
Yes,
of color?
a mole as well. So we got to be
Yeah.
careful if we're zapping moles, and the patients want those moles to stay. We got to go around those moles. We have our patients make sure they're not tanning during the procedures as well, because the tattoo machine can get distracted and go after the tan. In our darker skin patients, we have to be a little bit more conservative on those initial settings. We are also prepping their skin with a prescription grade cream that's relaxing pigment cells in their skin.
Oh.
And so by doing this, we make it a little bit more safer, and we still ensure some good results.
And you mentioned it just depends on the patient and the age of the ink to how many. It's very patient specific on how long it takes to get rid of them.
Exactly. Your amateur tattoos, the ones where the artist is not very heavy-handed, just use a needle instead of, say, a gun. The single color tattoos, the ones that are old, those are going to be a lot easier. 3, 4, 5 sessions to get rid of them. The ones that are multicolored, where the artist really meant their work of art to stay,
Right.
they're buried really deep. Those are going to be a little bit more difficult. They can take up to 15 sessions, and in some cases, maybe even longer.
How about parts of the body? You see I see a lot on ankles, and I'm thinking, ow, that had to hurt.
Yes.
Are those harder or easier to remove because there's not a lot of skin behind them?
Yeah, absolutely.
fatty tissue?
So one of the factors is the pain level as well, and and some tattoos are pretty easy to go after. Jorge could kind of attest to his
Yes.
experience. But the ones in the ankles, low back are a little bit more painful, so we have to use a little bit more conservative settings approaching those tattoos. The tattoos that are on the extremities, where there's a little less blood flow, the fingers and toes,
hands,
little less blood flow. So it's going to be have a less ability to process that ink that we're breaking down as quick, and so they may be a little bit more difficult to go after than, say, ones that are more central to the body.
Very good. Jorge, thank you
Yes.
so much for coming in. I
problem.
am so glad you came along. Tell me the story about your tattoos. How many do you have, and where did you get
Well,
them?
I got tattoos just about everywhere in my body,
Yeah.
but the ones that are affecting my life are the ones on my head and in my face.
Ah, I see.
And that's why I chose to remove them, because it brings so much negativity to my life and prevents me from getting a job. So that's why I reached out to Beautologie, and I was glad that they're willing to help me.
And this is something that you'd been thinking about for a while, or what was the realization that maybe it was the tattoos that was holding you back from your career?
Because I've actually been told in the interviews
Really?
that because of the tattoos, that although I am qualified and have the experience in certain jobs, I meet their expectations. That tattoos is a barrier, because they don't want someone from the streets who's still an active gang member, even though I am not, the other person might be, and they don't want a conflict to arise. And I could totally understand that.
So that's what it took, and then you're deciding that that's what
Well,
you're
not
gonna
only
do,
that,
and-
I just got full custody of my 2 little kids, and walking down the street with a 3-year-old and a 1-year-old and getting negative attention from other gang members is not good. It's not healthy for me or
you're
my kids.
thinking about your family
I'm
as
thinking
well.
about my family, my future, and I need to meet their needs.
So how did you find the Beautologie pro bono clinic?
I surfed the web for a while, and I emailed quite a few people and get no response. A couple people responded, but they had like a very outrageous, ridiculous bill
Prices,
that
right.
I couldn't afford. And Beautologie, I emailed them my story, where I came from, where I am, where I want to go, and I got a response. And I was like, whoa, cool. You know what I mean? And now I'm a pro bono case, like he said, and I'm just so grateful, for them. You know what I mean? I'm traveling over an hour just to get here to Bakersfield to get this done. But I'm going to do whatever it takes to get it away, remove this mistake I did, you know what I mean? Not all people with tattoos are bad people. We just made bad choices, and unfortunately, I've been painting for the last 6 years.
You got them when you were younger.
I got them when I'm younger, and like I said, even though I'm not in that lifestyle for the last 6 years, it's still affecting me today.
Do you have an opportunity to talk to other people who might be in your situation and explain why you made the choices you made and what you're
I
doing?
hope I do reach out to other people, especially young kids that have getting tattoos on their face or their hair like me. Because at the time I'm getting them, like I was telling Dr. Shaw earlier, that you got your peers that are telling you, "Oh, that's cool, you're down," but those people ain't gonna be around when you gotta pay your bills, when you gotta
It's a
support
very
your
good
kids.
point, right?
You know what I mean?
And your tattoo on above your eye, it says Shy G. Is that your?
That's my significant
name.
other, but it's also
Oh.
gang related. You know what I
I
mean?
see.
And most of these are gang related up here, and that's what I'm trying to get away.
You're trying to get rid of all the
Yeah.
ones that would be visible. And have you started your treatments?
I started my treatment a little less than 2 weeks ago, and it was very, very surprisingly to me, because other people have told me, "Oh, when you get a laser removal, it's gonna hurt, it's gonna burn, and everything," but yet they never got them done. So I kind of like, well, I don't know, I gotta see it for myself.
Yes.
And when I went there, I mean, from the moment you walk in, Beautologie is great. They got a great atmosphere. The staff is really good. They said the nurse that did the laser removal, she explained to me the procedure, explained to me what the side effects might be, if any, which I was fortunate not to have any at all, and they put me at ease. And when the procedure started, it felt like a rubber band snapped on my face, like, "Pah," which is not painful, really. I mean,
Right.
who hasn't got a rubber band snapped in their school age, you know what I mean?
Right.
And after that, I was home free. I was like, yeah, you know what I mean? Because I went there with the intentions to remove all my tattoos. And when I first got there, I kind of got stage fright.
Sure.
And I told him, well, let's just do this tattoo first,
See.
But then after the first session, I called back. I said, you know what? Let's get them all
Let's
done.
do it.
Let's do it. You
Well,
know what I mean?
gentlemen, thank you. Sit tight with me. We are going to go to a quick break. When we come back, though, we're going to have more, an extended visit today with our friends and sponsors from Beautologie. But first, remember, you are watching Live Well only on Bakersfield.com. We'll be back right after this. Good morning, everyone. Welcome back to Live Well. I'm your host, Lisa Kirsch. We have special friends joining us here today. One of our sponsors, Beautologie, Dr. Milan Shah, has stopped back by. We love it when he comes because he's always talking about great things. And then in the commercial break, we get to talk about some other things that we're going to do later in another show. Good morning. Welcome back.
Thank you. Good
Always
morning.
good to see you. And you brought along Jorge today.
Yes, Jorge with
Good morning.
us.
And tell us the relationship between you and Jorge, how you met and how you guys are working together now.
So at Beautologie, one of the things that we started about four and a half years ago was our pro bono clinic. We didn't know how it was going to go. We said, we want to offer something back to the community. And we said, what can we do in the cosmetic world that could accomplish that? And we said, well, we have our tattoo removal lasers, and we see a lot of people from different walks of life
Sure.
where they have tattoos that are just preventing them from taking the next step, whether it be, getting married into a new relationship, or getting a job, or getting into the military. And sometimes the cost of that procedure, it was a big, kind of brick wall for them. And so we said, well, let's start up a clinic where we could offer some of our services pro bono. And the first clinic was just amazing. We had all of these letters kind of pouring in, and we had to filter through them, but the stories were just great. And we had these clients come in, and we would listen to these stories, and then to get rid of their tattoo and then hear the end result of it. For example, guys that were laid off from work and a tattoo on their face or, forearm that was showing prevented them from getting a new job, or, a kid going to the military, or an ex-gang member that is just making a big change in their life. They just, need to get this stuff removed. Hearing all of those things being accomplished was so fulfilling. And at Beautologie, we love it. Our staff loves it. We volunteer our time, and it's very fulfilling. Jorge recently found out about our clinic, and so he's one of our newest enrollees. He started with us a couple weeks ago. He had a wonderful story. We're like, we have to help this guy out, and so we just started zapping his tattoo, and we hope to get him to completion here soon and have him make that next step forward as well.
Very good. Jorge, walk us through the first appointment that you had when you had the first initial zapping, the laser treatment done.
Well, like I said, when I first got there, I was nervous, and I walked into their office, very good atmosphere. The staff made me feel welcome, had me a little cup of coffee, got called back to the nurse, got the procedure explained to me by the nurse actual, and then Dr. Shaw came in and explained more to me, and that was like great, you know what I mean?
You felt
And
comfortable.
It felt comfortable because not only do they explain it to you, but they also give it to you in paper, you know what I mean? So you could also read about it. In case you forget what you heard, you could always go back and read about what they had just
Sure.
explained to you.
Sure.
And it was very, very, very welcomed. And like I said, it was not even painful at all. You know what I mean?
Did it hurt more to get the tattoo than did to get it
Actually,
removed?
it did because when you get a tattoo, you got a needle constantly on you. Bzzz, you know what I mean?
Yeah.
And this little zapping, like he says, a zapping thing, but it doesn't hurt. Like I said, it's just like a little rubber band, like pah, pah. And and
Do
most
you have
of
to wear eye protection?
yes,
and
some type
yeah.
of goggles. I'm not sure exactly what type they were, but I know it has something to do with the laser, of course. You know what I
Yeah.
mean? To protect my eyes or anything else around there.
Mm-hmm.
And it was not painful at all. I actually went through it without any like kicking or screaming or crying. I didn't cry or nothing like that, you know. And when I first went there, like I had told Dr. Shaw, let's just focus on this tattoo. But as you can see, I got tattoos all around.
I see.
And I was kind of scared to get them all. But after the first procedure, I called back right away. I said, let's do them all. Let's do them all.
Well,
you know what I mean?
honestly, I didn't notice the one that on the side of your head, and would the hair interfere with that? Are you going to have to get rid of the hair to get a better zap on that tattoo?
So what we would do is we would actually have him trim down the hair right before the procedure, and we had done this for the first session, but then we decided to take it a step at a time. There is a chance that some of the hair follicles where the tattoo is, where the ink is, may actually not grow back. The laser can go after some of those hairs. So we had this discussion with Jorge, and he's okay. I mean, it's not like it's going to go completely bald. Just where that ink is, and it's just very fine lettering, and so there is that risk. But if he was willing to, to undergo that, then we'll go after those tattoos for him.
So you've been to one procedure?
Yes.
And how many more do you anticipate?
So the tattoos that Jorge have, they're actually amateur tattoos, and they're single color, they're dark. I think they're going to take fewer than more. There's this range of 1 to 15 sessions, and sometimes they can go even past that. I'm hoping we could get his tattoos done in 5-6 sessions. It's hard to really know. I've said 15 treatments, and I've gotten tattoos done in 1 or 2, and then sometimes it's the opposite. But with his type of tattoo, I'm thinking definitely a lot fewer than more. So 5-6 sessions, maybe 6-7 months into it, he'll be done.
Is this something that you would tell your friends about, or
Of
you're
course.
so
I mean,
excited?
like right now, I'm trying to get into the career of alcohol and drug counseling, and in that career, you deal with a lot of ex-convicts, ex-drug addicts who have tattoos all over, and they're always looking for somewhere to take their tattoos off because they're trying to change their life as well as me. You know what I mean? And I'll be more than glad to refer them to Beautologie. You know what I mean?
Well, how does that make you feel then to know that there is a company here in Kern County that is willing to help people in your situation?
I think people like myself that are making that transition from being a gang member and coming from the lifestyle that we chose at the time and trying to make a difference in our life for ourselves and our kids it's a blessing having Beautologie helping us out. It's really a blessing. I mean, not too many people is willing to help somebody out, especially for us. What I mean by us is people that made bad choices in life. A lot of people look down on us, you know what I mean? So
It's kind of a new chance, a new start for you.
I hope to come back to Beautologie and be one of those success stories. Says, hey, I got a job. Thank you.
Yes.
You know what I mean?
And let
Give him a
us
great
know.
big hug, and
Yeah.
Thank you.
Well, how does that make you feel to sit here and listen
Oh,
to this kind of gratitude?
It makes us feel great. It's something that we're so busy, wrapped up in our day-to-day operations, and to actually just kind of take a step back and give something back to the community, it makes us feel great. And I'm speaking for all of our staff at Beautologie. We, our nurses, our receptionists, our coordinators, everybody kind of volunteers for this clinic. And I could tell you, every time we're done with the clinic, everybody just kind of has this big smile on their face. They're happy because they got to give something back at work, and it was great. So it makes us happy, and I love hearing the stories. We've heard of stories of people that have had their tattoos completely removed through the clinic, the pro bono clinic, and they've moved on with their life, they've gotten a job, and they email us back and call us back and tell us their stories. And it's just a very feel good thing, and we're definitely going to get Jorge to that point too.
Very good. Well, tell us more about these pro bono clinics, where they are, when they are, and how people can get more information.
Absolutely. So our next clinic actually is coming up here Labor Day weekend in Bakersfield. It's on Saturday. This one is completely full, but we were going about initially when we started, it was about every 5-6 months. Now we're up to every about 3 months because of the demand for the clinic. If you're a new client and you're looking to get rid of your tattoo, we have a website. It's tattoos@beautologie.com. And what we like for the people to do is maybe them or a friend can submit their story and where maybe a picture of their tattoos. If they don't have email access, they could actually come into Beautologie and give us their information as well. And then that we get a lot of applications, and we have a committee that kind of goes through them. And there's certain criteria, of course, that we have to have them meet. They have to be visible tattoos that are preventing them from moving on, with their life.
Not like a spring break mistake that no one would ever see. Kind
Exactly.
Of thing. Gotcha.
Exactly.
Not that I have one of those, but I know where you're going with that.
But yes, that's all they have to do. And, we're so excited because this Friday, as a matter of fact, in our Fresno Beautologie clinic is our first pro bono clinic there. That's one of our newer offices. So we're starting the, it's been so successful here in Bakersfield. We wanted to spread it out to Fresno. And so we're actually doing the pro bono clinic there as well. And it'll be going there every quarter as well.
And give us that website one more time.
Tattoos@beautologie.com.
Very good. This is very exciting. Well, we'll get technical with you for a second.
Sure.
And the type of lasers, is this the same type of laser that you would use, say, for like laser hair removal, or is this very specific equipment?
Sure. So, every laser we have at Beautologie is very, very specific in terms of what they go after. For hair removal, our laser is specifically targeting the follicle or the root of the hair. We have a laser that goes after sun damage that sees brown spots and causes a controlled burn of those brown spots. One that goes after veins. This one is called an NDQ switch YAG, and it's specifically seeing the ink in the tattoo, those blues and blacks and oranges, that ink, and it causes a controlled burn of that ink. There's a little bit of overlap in some of the, what the lasers go after. Like I said, with Jorge, with the tattoos in the hairline over there, they can sometimes go after the hair follicles, although they're really meant to go after the ink in the tattoo. So, but yes, very specific lasers for a very specific target.
And the technology, I know you guys are cutting edge everything. Is there technology that keeps coming out that's new and better and different? Can we expect something even better in a year or two?
Absolutely. So, like I said, we've had this, the tattoos going for over 5 years at our practice, and I could tell you we're already on our 4th generation of the laser that we're using. Wow. And so, yes, we always have it like having, the latest and the greatest in terms of, the equipment. And what that really means is we're able to go after the tattoos more effectively, more safely, and more comfortably. And so this current machine is one of the machines with the highest energy output, the potential to really have a great treatment with minimal downtime. It's something that goes after a variety of different inks, and we can use it in all skin types. There is another laser on the horizon again that we've been looking into that might get us there even quicker. So in one day we might have a laser with one zap, the tattoo's gone, you don't have to worry about it again. So.
Wouldn't that be something? Gentlemen, thank you both. Always good to see you. Thank you for sharing your time and expertise. Jorge, we really appreciate you coming in and sharing your story.
Not a problem.
And we look forward to seeing your continued success and hearing your continued success in your life as far as your tattoo removal goes and your new career and your kids.
All right, thank you.
Thank you both. Always great to see you
very much,
guys.
Lisa.
We'll see you again soon. Coming up next, bringing the endless summer to a close, we are heading back to school. It is that time already. We're going to get back into the routine with the help of our next guest. You are watching Live Well, only on Bakersfield.com.